So I've become engaged more directly with COHRED just in the last year or two. And it stems from getting to know Carol, the executive director, maybe a dozen or so years ago. At that time, I was the director of the Fogarty International Center at the National Institutes of Health. And we had engaged in developing a program on building ethics capacity in developing country settings. And Carol was one of our grantees, developed a program out of the School of Public Health. And so we got to know one another and have kept conversation going. And I think as COHRED has been moving in a new direction in building an innovation research for health and development and economic growth, the agenda really attracted my interest. And I think Carol thought that I might add a dimension coming from basic and clinical science, as I have, public health, administration, and building coalitions to address problems of the developing world. So I was very happy to engage and have just formally joined the board. So the colloquium this year really is a result of thinking about the development of research agenda and the support to engage in research across the whole spectrum of research, from very upstream basic science down to the delivery of products. And we had a recognition that this was not only the 20th anniversary of COHRED as an organization, but also the 20th anniversary of the issuance of a World Bank report, the World Development Report in 1993, which was called Investing in Health. And that Investing in Health report changed the dynamics of development from investing in infrastructure and dams and roads to the realization that if you don't have a healthy population, you can't grow and develop. Education doesn't work, nothing works. So the investing in health was a key turning point in thinking about growth and development in developing countries. And an understanding that what we do in health and improving health is based on knowledge and the need for a constant generation of new knowledge. Context changes, priorities changes, issues change, diseases change, some emerge, some disappear, some reemerge in new forms. So bringing the two together as an anniversary seemed like a very good idea. At the same time that the Lancet created a commission called the Commission on Investing in Health, which is reviewing the 1993 report to see where we are. So the linkage between the commission, which is going to assess where we are, COHRED trying to do the same thing, but the commission issues a report. It is published in December. The commission disappears. Who's going to carry forward the lessons learned? And so there's the clear-cut role for COHRED as creating a space where all of these ideas and supporting the continued investment in appropriate research can continue on. So I think back to the beginnings of COHRED was a fairly small enterprise focused on a very minimal agenda for research, which has grown enormously, and its focus has been on helping to build context and tools for better management of research and the translation of research into advances in health. And the focus has really been COHRED working with low and middle income countries. If we look forward and this building of an innovation research system within the countries, the real role for COHRED is in part continuing its connection with the countries and helping them develop their system, but more importantly now, at the same time, making the connections with the higher income countries that have traditionally made investments in research capacity and in research results, COHRED sits in the very middle ground between developing countries, and they are going to change enormously in the next 20 years, and the higher income countries who are going to have to learn how to interface most effectively. And I don't think, having spent several years at a major research funder in the United States, I don't think the first world high-income country research agencies will truly understand the context of the changing scenario without somebody in the middle. And that's the perfect ground for COHRED to occupy. And I think I try to imagine what this next 20 years will be without COHRED. I think it'll be orders of magnitude more difficult to make that link between research and improved health and economic growth without it. So I see that middle ground as exceedingly important.
Thank you very much.
Thank you.